So next, I'll pass it over to Borshika.
Thank you so much. I am very excited to be the facilitator, introductor of these two amazing researchers who I got to know from different places, actually. Elizabeth did a little bit of a sabbatical with our team, and so that's how I learned about her work and got very excited. And I immediately realized the potential natural connection with a very dear old friend, not her age, but our friendship being old, and colleague, Dr. Samantha Harden, with whom I have been working through the REAIM work group for many, many years now, and developed very close friendship as well. So this is just, of course, extremely delightful for me to introduce them working together on a chapter that was related to their shared interest in cooperative extension systems. And this chapter is a beautiful product of that work, and they will be talking about that. They actually came to present to us a while ago, and this is a return visit, so they are definitely returning presenters for us. I am going to do the introduction, and I don't want to shortcut it because it's wonderful to learn about the accomplishments of both. So I will go ahead and start with Elizabeth, Dr. Weybright, who is an associate professor and adolescent extension specialist in the Department of Human Development at Washington State University. She co-directs the Northwest Rural Opioid Technical Assistance Collaborative and has a background in adolescent development and prevention science. Her work spans basic research on topics such as adolescent experience and behavior to adaptation, implementation, and dissemination of community-based substance use prevention and positive youth development programs. She also her work occupies some efforts to build capacity among professionals and systems for delivery of evidence-based approaches. The work has been funded by federal and state agencies, and she has conducted work in collaboration with community-based partners. Her work seeks to use the extension network to more effectively deliver evidence-based approaches in partnership with rural communities to address health disparities. And Dr. Samantha Harden is the director of the Physical Activity Research and Community Implementation Laboratory within the Department of Human Nutrition, Foods, and Exercise at Virginia Tech. She has 12 years of experience leading and participating in research practice partnerships for healthy lifestyle interventions across various populations for chronic disease prevention and management at the individual and systems level. Her expertise in the previously mentioned REAIM framework include developing, implementing, and evaluating programs through this framework and consulting with investigators on applying REAIM. She blends her academic background with her passion for mindful movement, which is another area that I really admire. She uses science and the personal experience of clients, participants, and herself to promote that being active can change lives. Through physical activity, Americans can avoid chronic disease, feel better in their body, and maintain or find a better quality of life. She is currently working on publishing and promoting a book on how to integrate yoga and mindfulness principles in academia. Thank you so much for being here, both of you, taking the time to come back and tell us how the collaboration went and talk about your new chapter. And with that, I'm going to hand this back over to you too for your presentation.
Great. Thank you so much for the introduction. And you kind of queued up your role in facilitating our work together in our partnership. And so we're going to talk about that as well as we go through. But DISC and you, Borshika, hold a special place for both of us, especially in our work together. Today, we're here again to share about D&I within the cooperative extension system. And so I'll get us kind of kicked off with a little bit of an overview and a refresher of extension, and then talk about where this book came from idea to edited book. And then I'll turn it over to Samantha to dive deeply into the dissemination implementation chapter specifically, and then we'll have a little bit of time opportunity to chat with you all. So I'll share some links once I jump off, but one of them is that we came and spoke November 2022, and so we do have the link from that webinar as well. But I do want to give a refresher, and actually this map is an update from that webinar. I went on and made sure I had the most current version and made sure all my links worked. And the United States Department of Agriculture puts out this map, and so they had updated it. What I'm introducing you to here is what the land grant system across the United States and US territories looks like in particular. So even if you're not zooming into a particular state, you can see at a national level that multiple institutions, sometimes more than one in a given state, are part of the land grant system. And these little asterisks or the little icons indicate different years. So the land grant system became enacted in 1862, which are the oldest universities that are a part of that. In 1890, they said that we need to expand the land grant system to additional historically Black colleges and universities, and those were brought on as well in 1890. And then there were an additional group of colleges and universities in 1994, particularly tribal colleges that were added as well. Now, the intent of the land grant system is really our original dissemination network. It is to translate research from campuses and push that knowledge and information out into communities. I would be remiss if I didn't talk about where the land for the land grant system came about. There is actually a very lovely report, and I'll share the link in a moment, from Berkeley that talks about, particular to California, but the idea applies to most other states. They call it the land grab. So clearly that land that was given to states for the land grant system and universities were taken, and predominantly from indigenous individuals as well. So what does it mean within the land grant system to administer this program called cooperative extension? So cooperative extension is often administered through the original group of land grant institutions that have those kind of orangey or red dots associated with them. So I'm based at Washington State University, and we house the cooperative extension system. So what does that really mean? Well, let me give you, again, I stole this or borrowed this from the United States Department of Agriculture. But the cooperative extension system is this very interesting network and partnership between federal, state, and local levels. And at the federal, we have these federal institutes and organizations, associations that serve to support the activities within states, including land grant universities that I've just talked about. Within those, we have traditional academic departments, like where I'm housed in human development. We have the extension system where I'm, for example, affiliated. And then we often have what are called experiment or research stations. These are not necessarily related to health. They're often related to other industries of the state, but they can be tied to health. And then we have this local partnership that typically at extension, you're going to have some local and particularly county level presence of extension in a community. So in Washington, we have an extension office in every county in the state, and we have one on a reservation. And so there are employees within the state level at the university, as well as the county level. So what it is this infrastructure and system where you can reach communities with the expertise that's generated from the campus, and vice versa, right? That research and expertise can be informed by what's happening in the community. The research could be happening at the local level, or these experiment stations and so on. And it's a lovely network to be able to work and to translate research really into action. Now, there are some guiding pieces when it comes to health, because I would argue health might be the most new, although I wouldn't say it's brand new, area of research that we translate. Historically, it had been agriculture. Now we've moved more into health. So over time, they've provided additional support for what should health-focused work look like within extension. So in 2014, they put out this national framework for health and wellness. And I'm actually going to skip that one because later on they updated that framework. So in 2021, they put out an updated framework. And I want to share with you the visual if you haven't seen this before. So within this framework, this ecological model should look familiar to you. And it identifies kind of what's happening within each of these social determinants of health. What can the extension system do? What are some of these root causes? And what else should we be factoring in? This tab on the left-hand side are kind of what are the things that we should be doing in the extension system. And this is really intended to be kind of a guiding framework. It's helpful that this exists. And it's not the whole story. And so when we think about what does health and wellness look like in extension, we've realized that there needs to be more, and there could be opportunities for greater intersection, or there are folks that are already doing this work and we really wanted to learn from it. So I'm going to give you a little bit of a background of this book that recently came out. It's called Health Extension, Community-Based Healthcare in the Future of Cooperative Extension. I've never written a book before. I've never written an edited book. And so this is an interesting process that I got to learn from. So I'm a co-editor on this book alongside Cheryl Eschbach and Jeff Dwyer. And this book really serves to answer you might be asking the question of why is a book? Like, why can't you do this in a journal article or a webinar or another format? And we really felt like the narrative that was out there around health extension wasn't the whole story. And we wanted to represent the whole story, but maybe in a way that things like journal articles really wouldn't allow for. It doesn't need to be in a peer-reviewed outlet necessarily maybe there are stories that haven't been shared, or ways we wanted to push back on what has happened before, and ways we want to show what the path forward could look like. So in response, the intent of this edited book is really to promote health extension as an authentic partnership between healthcare and community organizations and the cooperative extension system, to lay a foundation of what a health extension includes or what folks might want to know to do this work, and to frame the history of the United States, the cooperative extension system, and the emergence of health as a growing focus in extension in ways that, to be honest, acknowledge the things that we haven't done well and look at how we could do this better going forward. So I want to give you might be asking yourself, well, what's health extension at this point? How do you define that? So health extension, as we define it in the book, is health-focused education, programming, intervention, research, and this part is important, which is why it's in a different color, in which the assets of the cooperative extension system are leveraged as an authentic partner to enhance community-based healthcare, academic health systems that include medical schools, public health, prevention outcomes, et cetera. So you can see this is kind of broad. There have been other health extension efforts. There's primary care extension, if you've heard of that. UC, San Francisco, University of New Mexico, they kind of have talked about health extension before, but often from a healthcare-based perspective. And they actually talked about, we would love to replicate the extension system and do that for us. And I think the motivation intent behind this was, wait, maybe we don't have to replicate. Why don't we leverage and really engage as an authentic partner? And that's why this is important. So this has been kind of a thought process personally for me. And so I want to give a tiny bit of the journey and maybe demystify how you get from an idea to a book and what that looks like just briefly. So I had written a white paper about health extension for my institution just to kind of flesh out my ideas and at least be able to advocate for it in a thoughtful way. And in that, I kind of outlined maybe there's 4 wedges. They kind of look like this. And this was based on other research readings, conversations that I'd had, really just pulling things together, and thought maybe, there's extra pieces that we haven't quite identified. And I found a lot of inspiration in what Michigan State University had been doing. And so I reached out to Cheryl Eschbach and started reading a lot of her work and their work to see how they've been looking at and thinking about health extension. And I'm going to pull a slide that she had previously shared that outlines the Michigan State University model of health extension. And you can see there's these 4 pieces of partnerships, preparing educators to engage in research. They have an RX for Health, referrals from health providers, and enrollment to extension programs, and then exploring innovative funding. And when I thought about this and I looked at what the Michigan State model was, and then I compared it to kind of what we had been thinking about here at Washington State University, or I had been thinking about, there seemed to be some overlap. At least the broad categories, I could see where the work they had been doing would fit in. And I was coming up on a sabbatical and I thought, let me reach out to Cheryl and see if she wants to talk and work together. So I emailed her. I told her I loved her work and I would love to keep connecting and figure out what something could look like, a partnership could look like. I didn't just email Cheryl though. I emailed Borshika and all of you at DISC to say, hey, I really need to better understand dissemination implementation science in order to inform this work. So how can we continue to move forward? This is just an example, again, to demystify the process of, it doesn't hurt to start with a little bit of flattery. I've liked your work. And I was really transparent that a year out, when you're having to plan, I don't know what this is going to look like, but I'm flexible and I'm just here to learn. I just want to figure out and think and put all of these pieces together and kind of connect with others. Fortunately, things fell into place. And by the time I went on sabbatical, which was the fall of 2022, it worked out in a lot of ways. And so I got to partner with University of California, their extension system, which is Ag and Natural Resources, or there's the label, all of you at DISC. And then shortly after I started on sabbatical, CIRC happened in 2022 in San Diego. And so I got to go and kind of soak everything up. It was my first CIRC conference or meeting. And at that meeting, I got to connect with Cheryl Eschbach and Jeff Dwyer and talk about this book and kind of start to formalize and put this idea down. The prospectus for the book was due in November of 2022. So let me talk you through just quickly through the timeline. So after the prospectus was accepted and we were officially under contract in March of 23, we had authors who drafted chapters. We had some back and forth through the spring and summer. And in September, this is what this image is, we all got to meet and review the chapters, think about what other edits there needed to be, clean up loose ends, and ultimately submitted a full version of the book in October of 23, which is, to me, is quite a bit of work happened over that spring and summer. It was impressive when you look back, and impressive that we could convene all of the co-authors that we'll highlight in just a minute. After some back and forth with additional edits, the book was published in December of 2024. I do want to point out in this image, I don't know what to even call it, a painting, the visual that's behind us on kind of the fireplace mantle was created by Jeff's daughter, who is an artist who also helped us create the cover imagery for the book. So that was kind of a fun personal touch. So what the heck is in it and who is represented? We tried to separate the book into a couple different sections. One is really kind of maybe foundational pieces or process pieces that we think are important. So Jeff and Cheryl talk about the origin of extension and healthcare and what that looks like. We have a chapter, and I saw Lauren Kennedy's here in the Zoom space, about health equity and extension, what that has looked like in the past and how we can learn from that to move forward. Some colleagues, Allison Myers and Leslie Lytle, talk about health systems, payers, providers, that if you're in extension, maybe newer audiences for you. We have the chapter we're going to hear about in just a moment from Samantha about dissemination implementation science, one about diversity, equity, inclusion, and what health justice looks like with a number of colleagues. And this one is really interesting. It has personal stories that are in that chapter. And then we have kind of a history of what's called family consumer science and what that looks like and how we can use that area as kind of a pivot to talk about health extension. And then we move into some kind of content or what we would call application areas. So we see health extension in agricultural mental health, in disaster education, and community-based approaches to substance use, in particular opioid misuse, and then it kind of closes out. Part of the reason we wanted to, again, the benefits of doing a book is we could bring on folks who maybe are junior scholars or different folks than, maybe you wouldn't necessarily work on one peer-reviewed journal article with them, but we could bring additional voices to the chapters in that way. So I want to give you one more kind of overview of the book when we think about what's the purpose and who's it going to serve. I actually think we have two quotes on the back of it that of folks who reviewed the book ahead of time, and I want to share those with you. So this is a quote from the Dean of the College of Family and Consumer Sciences at the University of Georgia, who talk about the importance of this book to those who work in administration and extension that have a health-related focus. Talks about the benefits of extension, the strong and trusted presence in communities, and really what we were hoping to see is that it provides examples for other health professionals or those who are outside of extension but partnering with extension and some of that history and how we can move together with that shared goal of addressing health. And then a colleague of mine who's a retired faculty from human development who has worked in extension her whole career, talks about the opportunities and challenges of creating health extension or moving forward with a health extension model that's really integrated across all of the areas within extension and grounded in authentic values of health equity and justice. So I wanted to take an opportunity, especially in this meeting, to dive a little bit into one of particular chapter 4. And so I'm going to turn it over to Samantha to do that, and I'll share some links in the chat while she's presenting.
Thank you so much, Elizabeth, and also to Porshika for, as we mentioned before, just being a bridge. And I hope that those of you who are sitting on a bold vision and a roadmap to whatever it is that you want to create, just keep in mind how important networking is to bringing everything to life. So I just so appreciate seeing some of that from the raw, like, here's an email, here's an idea, and now it's a book that you can purchase. And also gratitude for Lauren Kennedy for being on here as well. So I know Elizabeth said I'll do a deep dive, and you can be the judge of that if this feels deep or superficial, because there's so much to share. And I'm only going to do it in 15 slides because, in part, as we create this roadmap, we want to have more conversations with you all and talk a little bit more about, we're kind of explaining a bit about this like nebulous system, and we'd love to hear from you as dissemination implementation scientists how we best communicate and partner going forward. So I'm going to go through some of the kind of key pieces of this chapter as we make our way towards discussion. So, of course, this snapshot of the chapter couldn't be done without the work from the minds and hearts of our colleagues who are pictured here as well. So a moment of gratitude for them. And then I think what's interesting, and I appreciate Elizabeth sharing the map, Cooperative Extension is federally funded through the United States Department of Agriculture, which makes it really hard when we talk about health. And even the title of my department, as you might recall from about 40 minutes ago, it's Human Nutrition, Foods, and Exercise. And exercise and physical activity promotion seem to be kind of these latter thoughts within USDA and within colleges of agriculture, because that's not necessarily, what they envisioned when people were initially literally going on to farms. And I love sharing that kind of in 1944, when Family and Consumer Sciences was born, it was born out of this idea of people going from universities to farmland and teaching about crop and soil rotation and these types of things. And the householder would come out and say, who's here? And that became an opportunity to say, let's talk about nutrition and diet and food safety and handling and management and all of these things. And then, of course, as we transitioned to our current ecosystem, all of the things, there's different ways that we need to address physical or health, and physical activity can become part of that. And I think I pause here because just thinking about like the needs of Americans in the 1800s, in the 1940s, even in 2014, and the language that was being used, and how a decade later, we're really still seeing we need these community-driven partnerships. And that's part of what my research and this chapter is really about, is, as Elizabeth mentioned, there's so much more data about the clinical partnerships, but how are we leveraging existing community strengths? And so this really creates the argument that dissemination implementation science is both cooperative extension's past, but also our future. And how do we contribute to the health span? And there's a lot of work around how do we implement, because a lot of folks in extension don't necessarily identify as dissemination implementation scientists, although they're doing the work. So we have this kind of push and pull both within the system, but then also for dissemination implementation scientists who want to use or leverage the assets of cooperative extension, as was previously highlighted. You might be wondering how do I build these partnerships? How do I ensure I understand the culture and context and resources? And it's just like every other large system and entity. It starts with networking. It starts with understanding. It starts with this background. So the chapter really anchors to theories, models, and frameworks. And it talks about how there are so many opportunities to advance kind of the chaos that is dissemination, implementation, science, theories, models, and frameworks, and which ones might be best used for your specific research question. And I wonder which ones you think we highlighted, and feel free to add in the chat, but just to be aware of time, you might have already assumed we highlight PRISM and REAIM. And so we talk about the metrics and tools, both quantitative and qualitatively. We spend a lot of real estate in the chapter talking about EPIS and how this has been translated for a variety of research questions and different intervention integration in different contexts. And of course, we also talk about CIFER. And so for those of you on this call, that's unsurprising. But again, a lot of extension folks are either doing traditional CBPR and not necessarily looking at the meta or multi-levels, or just not identifying with dissemination implementation science in general. And so another focus of the chapter was a lot about adaptations. We provided a deep dive of the types of adaptations that might be red, yellow, or green lights. We also provide on the left the model of the 5 best practices for balancing fidelity and adaptation. And that might be of particular importance for those of you on the call, because as you think through how do I get my evidence-based program policy practice to work with an extension, there will be adaptations. We talk a lot about how the beauty of extension is it's a national system, but even as Elizabeth mentioned, in Washington, there are folks in every county within the state. But in Virginia, we're not as resourced right now, and there are multiple counties who don't have agents, or there are multiple agents or health educators are our master's level community educators. There might be one educator covering 5 counties. And so just thinking about how it's just not apples and apples to apples. So just kind of thinking about the adaptations that would be needed to fit within the state's policy, the resources, and just kind of thinking about even the geographic location. So obviously these slides will be available for you to look at again, but thinking about where the land grant is and then what that means for the disbursement of resources as well. So what was also really interesting is that a lot of cooperative extension work happened in silos. And in some of our work, we talk about the multiple levels that we could be addressing for health promotion, where there might be a couple of brave souls, particularly in Kansas State Extension and Missouri Extension, North Carolina Extension. They've been really leading the way with things related to physical activity promotion. But again, it has to fit within the infrastructure, and how generalizable it is across different states and territories is going to vary. And so my point here is, are states more similar or different than we think they are? And I think that will be a debate for another time. But when you think, oh, I can disseminate across the entire cooperative extension system, the same processes that we use for any evidence-based intervention integration in a clinical system, in the VA system, et cetera, all of that needs to be applied to understanding cooperative extension and the different states and territories, their values, their mission, and their resources. And I wanted to wrap with a little bit about the chapter ends with a discussion about our way forward, really being about health equity and health justice as a core value. And again, perhaps a unique piece is this community clinical linkage. And I think that when I'm deep in the literature, I often see when people talk about community-based entities, they might be talking about kind of nonprofits or school-based systems, and cooperative extension still isn't very readily on the list. And so hopefully when we're speaking to you all in 10 years, this book, our efforts as a collective, help create opportunities for cooperative extension to be a go-to for health promotion instead of one of the last partners you would think of, because oh, that's just ag. So many times I end up in different conference spaces and I'm talking about cooperative extension, and I'll say, you know, how many in the room are familiar? It's usually not a lot of folks. And then I say, has anybody heard of 4-H? Then we get about a third, maybe a half of the group, depending on if it's national or international audience. And it's like, how did 4-H do such a better job of marketing than the rest of cooperative extensions? Incredible assets and entities. So there's this whole thing about extension being the best kept secret, and that, as we know, is we need to start really looking at that from a dissemination science perspective. And also ending with there's such a rich opportunity for capacity building and for folks like you all with DISC and us to partner, because training technical assistants and understanding all of these things need to happen kind of bi-directionally, because again, there's a wealth of knowledge that the community-based health educators have about their participants, about their physical resources in their community. And once you have perhaps an advisory board or a council or something like that, so that you're ensuring that your work actually fits the need. I would say my one piece of caution is that sometimes folks will hear about extension and say, great, they're going to go and deliver my evidence-based intervention, and not speak with the university-based specialists, not get letters of support from the agents or health educators, depending on what state you're in. They're sometimes called health educators or agents. And so just really understanding that everything you know about dissemination and implementation science is very much alive in the processes for building capacity, both building capacity for dissemination implementation scientists to tap into cooperative extension, and an opportunity for cooperative extension professionals and volunteers to learn about dissemination and implementation science methods, measures, etc. So with that, I want to end with really thinking about a call to action of ensuring the appropriate level of pushing and pulling the interventions, the processes, etc. Again, with that caution of not just assuming it's an open and available system to engage with whatever needs to fit. It's what are the community concerns, what are the resources, and what is the answer, and equipping with a menu of options. And then of course, overlaying our implementation strategies so that it's not just one and done, but it's actually integrated within the system for long-term health behavior change. So I'm so grateful for Elizabeth's vision and for being able to be part of this chapter and work with so many folks that even I think it's very interesting. Laura Bayless is one of the co-authors on the chapter, and she was one of my PhD students. And knowing that sometimes even when you attend a land grant or work at a land grant, you don't even know what that means. And you hear cooperative extension, or it's kind of this thing going on in the ag world, but we are a very passionate and rich system. So I hope that you consider partnering with Cooperative Extension on some of your future endeavors. And with that, we'd love to hear more from you all about anything about the book. I hope you just feel that some of this information jumps off the pages for you, but we'd love to hear from you all about how you see leveraging extension in your implementation work, and any suggestions on how you think we should get the word out. Like, who should we be talking to? I know being here with you all is probably a great step, but also any other networking, we're here for the dialogue. So I'll keep these up for these two questions up for a moment, but I'd love to just open for discussion.
Thank you so much, Elizabeth and Samantha. Really wonderful summary, and how exciting to see a book and specifically this chapter out for everyone to consume. I still don't know enough about these opportunities, and I always, every time I meet with Samantha, I keep asking more and learning about generally the culture, how it's different from how I am used to work, and I have not engaged in this type of work, but the opportunity is tremendous, and so it's wonderful to hear about this. I also appreciated, Elizabeth, your justification why you would choose a book versus other type of dissemination format. I don't know that we always go through this very thoughtfully and what is the best way to share information. And so I just loved the opportunity to hear about that thinking as well. Samantha, thank you for making my life easy and putting up questions for us. Why don't we start with these actually? And I would love to encourage everyone to feel free to unmute yourself, come on turn on your camera if you wish, and we can have a conversation. If you prefer, feel free to use the chat. That would be also appropriate.
I don't have a question yet, but I will just say I'm really, really excited about this work. I'm always been interested in like rural areas specifically, and so cooperative extension has very much like been on my radar, but also has not been, you know, kind of something I've really done anything with. And I never really thought about this, like the health extension idea is totally new to me. I love that framing of it. So I just think there's a lot of really cool opportunities here. I'm really excited to read this book. I just looked it up on Amazon. It's easily available. I can get it to me on Saturday. But it just looks like really great work. I think there's so many opportunities in all different areas of health and well-being. So thank you for this work.
Thank you, Elizabeth.
So while we wait for others to ask questions, I will take my opportunity and would like to ask, I'm still kind of thinking through how I could, engage with this work, and you provided some examples, but what are perhaps the kind of the hottest topics that we could bring to this space, and what would be not so great ideas? Because I think that kind of distinction is so important. So if you have any guidance, initial guidance on this, and perhaps add on, who would we reach out to if we were interested in learning more?
Yeah, so this is where there are a lot of benefits of that federal, state, local partnership, and the opportunities it leaves are that each, like Samantha said, each state is different. So each state may have different priorities. In extension, each state is likely to be structured differently, and personnel even look differently. So as an example, in Washington State, our extension is comprised in 3 programmatic units. One is youth and families, one is community and economic development, and one is agriculture and natural resources. Those general groupings seem to be, you can typically find those or some variation of those in different states. Sometimes we have a 4th of like 4-H youth development particularly called out. So there's a few different things that there may be state level priorities that are driving what folks are doing. There may be interesting groups. And so I didn't know this side of extension until I started working, trying to reach other audiences that I probably couldn't reach without extension. So there in Washington State, we have a lot of commodities. California has a lot of commodities as well. And by commodities, I mean things you are producing and selling.
Mm-hmm.
So we actually have commodity groups. And so there are things like the Wheat Growers Association, and I'm just questioning myself if I got that terminology right. The Wheat Commission, excuse me, I think is it. These different commissions and commodity based on the commodity groups we have. So there may be one for tree fruit. There may be one for berries. There may be one for wheat. We grow a lot of wheat in Washington. And at first blush, you may think, I don't grow wheat. I don't know that I care about that. However, it's been interesting to see the greater awareness of mental health, of behavioral health in these agricultural communities and these growing communities. And so I think for me, that's maybe a non-traditional partner for me that I wouldn't have thought of, but it can give you access to another group of people through a trusted source. So if I can work with the Wheat Commission to reach the growers, for example, a mental health promotion or suicide prevention intervention, then that's kind of an interesting avenue. Now, that looks different in every state. And so the reason I mention all those examples is that in California and Pennsylvania, for example, these systems may look different and the priorities may look different. So looking at what are the strategic plans, what are those kind of profile areas, what are those content groupings? There are some consistencies though, and so Samantha put in the chat about SNAP-Ed, Supplemental Nutrition Assistance Program Education. And so you have SNAP, but there's a separate program called SNAP-Ed, and they do provide not necessarily just direct education, but to me, they've been one of the best examples in extension of folks doing evidence-based policy, systems, environment work to move the needle to support individuals and communities when it comes to nutrition education and nutrition generally. So they're obviously a kind of a good example and probably have really good infrastructure and evaluation and reporting to partner with and work with. So that's one example, but what those partners look like on the local level may look very different. And so that's what I mean, that you might not have a SNAP-Ed person in your county. Maybe they're in a county over. And so that's just so trying to find the right partner who has some sort of shared interest that you and you can develop this kind of mutually beneficial relationship with. That's the long answer. The short answer is I showed up and started listening and started talking to people about what I do, what do you do? That's so interesting. And it was just developing a relationship, which I think is consistent across, anyone who's working in and with communities.
Thank you so much. And I see Samantha has some great guidance as well in the chat. Did you want to add anything, Samantha, to that, or?
Yeah, I think I was just thinking through, so I'm not gonna, I know this is being recorded and also like don't want to center, but I would say that from a dissemination science perspective, there's a real opportunity to look at what intervention characteristics we are sharing, especially from the beginning. And this is something I'm talking about with a lot of our teams across the Commonwealth of Virginia, because, physical activity, like if they're saying my constituents need a cancer prevention program, diabetes, cardiovascular disease, obesity. I'm like, oh, physical activity works for all of that. So it's how to, or mental health and well-being or social connection. And so part of our job as the intervention kind of developer or refiner or the technical assistance and training person, be really clear on the characteristics of your intervention that you're peddling, like really be able to sell it that this meets the needs of your constituents and use language that is appropriate for them, and understand also that one rural expectation is not the same as the other, right? So I know we've lots of folks are talking about this, but like rural health is not a monolith. So making sure like you are doing those deep, whether it be advisory boards, focus groups, et cetera, like really understanding what the community, again, that push-pull, so that you don't work for 2 to 5 years trying to build that partnership and they're happy to take the percent FTE, and then it's really not something that's sustainable. And then the only other thing for those who are not able to monitor the chat, it's just and just to echo what Elizabeth said, it's showing up, it's networking, but I think we're trying to do a better job at saying like, who are we? Where are we? Because most people are like, I don't even know. So if you are at a land grant, or if you just want to partner with someone at a land grant, go to their website, look and see who's tagged as a specialist, because that's going to be one of the easiest ways to find. And even if someone messaged me about nutrition, I would know who to send them to. So even if you find the wrong person, we have such a network as specialists that we might be able to get you to the right place. So that would be my suggestion to start. And of course, reach out to Elizabeth and myself. We're happy to continue the conversation.
Well, that's what I was waiting to hear. But thank you. No, this was very helpful thinking it through. And it sounds like, based on my view, that UC is one of the land universities, and that we could find someone who is at UC, I assume, is a specialist, right?
Yeah, the California system is different than a lot of other systems, I won't lie. So a UCANR is the entity that houses Extension. They have different institutes, and so if you can find those topically focused institutes and reach out to folks. But there's also folks on campus, a lot at UC Davis. So you're going to find folks kind of sprinkled throughout. Yeah.
Okay.
But
Thank you so much.
I totally echo the offer to be the point of connection, or at least point you in the right direction for folks who are interested in this.
Thank you. I'm also looking at the chat, and Amanda, thank you for sharing your comment. If you would like to comment camera, you are welcome to share a little bit more about this, or I am just happy to read it.
Hi. I don't know if I have much more to comment, but yeah, I think it was Elizabeth, you were saying, to your point, like the California system works potentially a little different. So if there's any insights, because you responded. I was looking when I had a grant that I was developing and putting in and looking for to connect with either SNAP-Ed or FNEP, food resource management type of classes, but I didn't have much luck. So I don't know if it's just San Diego County that's like that or what, but yeah, I guess I'm confused how it works here, and so I'm still learning a little bit.
Yeah, let me put a name and a link in a chat for you of someone to reach out to. And if you want a personal connection, I'm happy to connect you with them as well.
Thank you.
Yeah.
And then for those who are connecting outside of California, but also perhaps within, I will share that while FNEP and SNAP-Ed are again great examples, they have a lot of federal mandates that they have to respond to that are different from family and consumer sciences and 4-H. So if you're looking to do diabetes prevention, again, my world is a physical activity promotion or anti-bullying, all of these types of things, like FCS and 4-H are also different partners because FNEP and SNAP-Ed in every state and territory have very I guess just strict guidelines on what interventions they're allowed to deliver, the evaluation metrics they're allowed to employ, like all of these things. And so they might seem like the best fit because of the population they serve, but then they might have more restrictions. So I would definitely build those partnerships with the directors. I think there's only 3 states where it's the same director for FNEP and SNAP-Ed, and then there's different directors for each program in different states and territories. So it starts to get a little messy. But again, I would say for sure that that building the partnership and the showing up, yeah, and I'm surprised someone didn't respond when there's opportunity to collaborate on a grant, but emails get lost for sure. So
I will maybe put 2 other plugs. One is that from a funding perspective, there are mechanisms that are only open to land grant institutions. So you might not, I wouldn't originally think that the work that I do would fit under USDA, and in particular the National Institute on Food and Agriculture, NIFA. But we have had success funding grant, and they're programmatic grants. So we have layered the research on top of it while still achieving the programmatic aims. And as an example, we received, it's a 5-year grant mechanism called the Children, Youth, and Families at Risk, or historically has looked like this, where we adapted an evidence-based program and evaluated that program. So you can do implementation research with some of these funding opportunities. And so that might be another bridge of maybe a community, or they're missing some particular expertise that could be brought on the D&I side. It could be a great partnership. The other piece that I'll offer is related to the book. If there are folks who are like, I want to check it out, or I'd love to talk to someone and hear more about it, I'm happy to, I'll put my email in the chat, but I'm happy to connect with you. I'm happy to talk with you about it. Whether that's a particular chapter or the book as a whole, this is not necessarily a money-making venture. It is kind of more of a passion project, or just something that we really feel is important, that we wanted to get a foundation of information out and something to jump off from and really kind of get running and move forward from there. So I'm happy to talk about it in any setting or any context, anything related to the book.
I'm so sorry, I am having a hard time with my volume here, but I hope that you can hear me now. We have a chance for one more question, I think, before the top of the hour. Let me see if anyone else would like to jump in with a question or sharing any connection. I see at least one person here who I know also works with the cooperative extension system, but I don't want to call out anyone. So if you are willing to, it is such an interesting and different opportunity that, again, we are not as familiar with. Let me wait. I'm going to wait for a second and not talk, but then I have a quick question if no one else will jump in. If not, then I have a very quick question, and you can answer very, very briefly because we don't have too much time, but perhaps it's a good food for thought. When you think about grants that you write for these different types of funders, are we talking about similar area of study designs or measures that we use, or is there a difference on how to approach the design and measurement question?
Go ahead.
My quick response is both. Oftentimes, if it's a programmatic grant, they will have their own requirements. So we've balanced how do we meet the requirements of the funder when they have measures that aren't what I would ask, and how do we add the measures we want to ask without overburdening the participants. So sometimes we have to compromise, but that's kind of where we have been successful at having programmatic grants and getting research out of those. It may not look like what it would look like if it was an RCT or, but we can still achieve both of those aims. Is your experience similar, Samantha?
Yeah, absolutely. And the only thing I would add is, and I'm sure you all experience this with other community partners, but I would say that a lot of our participants are used to cooperative extension programs being like free, readily available, et cetera. And so when we're asking for surveys, I mean, I just got data for my 2024 program. We reached 938 people. Guess how many surveys we got back?
Don't want to guess.
36. I was
Oh.
like, is this a joke? Like, what am I supposed to do with that? But the beauty is it wasn't research. So I'm like, okay. And again, this is where I'll do a shameless plug for Reaim, because then I can talk about reach and I can talk about the sustainability and I can talk about how many counties are adopting and how many states are adopting, but I can't talk to you about effectiveness. But if it's based on an evidence-based program, now it's being sustained and my research question's different. How do I build capacity? How do I extend? And I hate to do this, but I have to teach at 6 o'clock. So I will see you all perhaps in 2 years, if not sooner. Thank you.
That would be wonderful. Thank you so much to both of you. Thank you everyone for being here, and look forward to our next session next month. In the meanwhile, be well, and wishing you all the best.
Thank you.